Good evening, fellow town hallers. Hope everyone's doing awesome on this Sunday night, April 5th, in day who knows what of Corona lockdown. What day are we on? Anyone knows? Let us know in the comment box. What day are we on? Feels like we're day 73. Hey everyone. Thanks everyone for joining. Ronan Kashi wants to be live. I'm sure that's a mistake, but we'll try it anyway. Ronan, did you mean to go live with me on virtual town halls? You did. Ronan,
No, no,
you're
no.
good. That was a mistake?
That's a mistake.
Mistake. Okay, no problem. Next. Anybody else want to go live intentionally before the 9 p.m. panel with Mayor Pedram Bral and Dr. Afshine Emrani? Hey Esther, Mohiban, thanks for the thumbs up. Thanks for joining. Thanks for all the support for virtual town halls. We're getting a lot of positive feedback, working on a lot of very exciting town halls in the future. Very engaging content and topics for everyone. Give us a few minutes and we'll be on live, I think, shortly. I think we're about 4 minutes away from the mayor going live, and we'll be here for the pre and post game. If anyone has any comments or questions, pre-questions that you want to raise for the crowd that's here, that's gathered here, please feel free to either enter it in the comment box or request to go live, and you'll grab the camera and the mic and voice your opinion and your questions before we have an opportunity to hear what the mayor is going to say. Hey everyone, thanks for joining. Hi Yuri, Maria, thanks for joining. Evan, thanks for being here tonight with Virtual Town Halls. Hope everyone's doing well. And we're just a couple of minutes away from the official start of the event. And we'll have an opportunity to watch together and comment afterwards and have a discussion about what we heard, what we didn't hear, perhaps. I think in the last few of these, I was a little bit dismayed at the things that we didn't hear. And I would like to hear some of those things addressed, hopefully, by the mayor and Dr. Imrani. Hey, Sharon Ahdoud, 26. Thanks for joining. Thanks for the thumbs up. Thanks for the excitement. We're just about ready to get started momentarily. You have any questions? Things you'd like to hear? What is it that you would like to hear spoken about tonight by the mayor? By all means, let us know, or grab the mic and let us know that way, or comment in the comment box below. Should be able to see that. We're almost there for start time. Bear with us 1 second while this gets underway. It's live stream. everybody. This is the second series with Dr. Emrani. I'm just waiting for him to come so we can start. If you're on already, Dr. Emrani, if you can just sign off and sign on again so I can find you. I don't see you yet. Just one moment. So it looks like the mayor, excuse me, it looks like the mayor is having a little bit of technical difficulties getting going here with Afshine Emrani. And let me see if I can find Dr. Emrani. It's a little bit delayed. In the meantime, easy camera. Meantime, I'd like to offer wishes of l'chaim, salud, a little bit of comedy here, lightheadedness. Salute to everybody with the corona lockdown. Okay, so hello and Shavua Tov. Back we go. I'm taken aback by the mayor's assumption that his only audience are Jews. Shavua Tov, Dr. Emrani and Mayor Bral. But we have other people in your constituents that are not Jewish. Okay. Is Remy? I hear you fine. Do you hear me? Sure. Everything looks good. Excellent. So I want to thank you again. I think this is a great opportunity for me to learn something from you, obviously, from the things that's going on with the new research and the medications that are coming up with COVID-19. I think a few questions that have come up with that I would like to bring out to you. First, I think I wanted to send a message. I'm going to send a message now. I'm going to send a message at the end again. I know with the holidays that are coming, Easter and Passover, we all would love to spend time with our families. And unfortunately, as we know, this year is going to be different than every other year for the past so many years that we all have been celebrating it. And I'm urging and really asking everyone to stay with your nuclear family. This is a different year. I have seen many COVID patients in the hospital, and if you guys have read my posts, you see that there's so many codes, meaning so many people can't stop breathing and they need to be intubated, many of whom cannot be extubated, unfortunately. So this is not a joke. It's not a simple virus that people get and they get better. Majority do. But unfortunately, the ones that get sick with it, they get very sick. So it's extremely important for this year for us to really spend the time with our nuclear family, we get to know them, and hopefully next year we can celebrate with everyone together. And I'm sure Dr. Emrani agrees. Amen, amen. I think that the only thing I would add is that please don't lose your patience. These next 2 weeks are going to be the highest climb that America has had. And hopefully after the next 2 weeks, we can plateau and come down. So it's extremely important that in the next 2 weeks, we try to do everything we can to keep our families, ourselves safe, our city safe, and stay out of the emergency room so we can let the doctors do their work. Right. Also, as far as traveling, many people say, well, if we travel just our nuclear family, we can go to California or Florida, not California, I'm sorry, from New York, they ask if they can go to Canada or they can go to Florida. Again, the recommendation is to please stay put. Unfortunately, we in New York are at the highest number of infected people. Many of us could be asymptomatic carriers. We do not want to take this virus to areas that may have a lot less number of people that are infected. We don't want to infect other people. It's extremely important to stay put in your city, in your village, in your town, and spend time strictly with your own family. As we have both said, I believe that we believe it's a great idea for people to take a walk, again, with their own nuclear family, as mental health is extremely important. And I appreciate everybody to really adhere to these requests and obey by the law. So one of the things that I've been recommending in terms of walking is always wear a mask now, because we are, like I said, in the peak of the virus doubling. And so make sure you are wearing a mask. If you don't have any type of mask, wear some scarf or something around your nose and mouth. Anything will be better than nothing. And make sure that when you walk outside, you don't go into any crowded areas, and keep your 6 to 10 feet distance from other people when you're walking, preferably 10 feet when you're walking. But outside is probably lower risk of getting it, even though we do know that the virus is airborne. And in airborne, you know, if somebody sneezes across the street or coughs across the street from 20, 30 feet, the chances of you getting it is extremely low. But if you are, for example, in a closed area, such as a bus or an elevator, and somebody coughs, then and you go into that small area even an hour later, then you could pick it up. So that's why it's so important that you stay at home and you only go outside in the open air for mental health and for physical health, to walk with a mask, with your distance kept. So a question that I just saw is, like, how many weeks or days are they still carriers after they are symptom free? Dr. Emrani? I'm sorry I lost you. Say the question again, please. Your voice came in and out. One of the questions that I hear a lot is, how many days or how many weeks after people are asymptomatic are they still spreading the virus? So typically we say 2 weeks, but, you know, it really can happen up to 28 weeks after that. So 28 weeks. I'm sorry, 2 weeks. I mean 28 days, not 28 weeks. I've been inside for too long. 28 days. So I would say, if you really want to take extra precautions, I would say, you know, go an extra week after that. So 3 to 4 weeks would be the most, but typically after 2 weeks, you know, we say that if somebody wants to return to work after 2 weeks of you know, being asymptomatic, then they can return to work. So the other question that I just saw is the surgical masks versus N95s. What does I mean, obviously N95s are what is more protective, or most protective, I should say, when it comes to getting infected. But the question is, can surgical masks protect you, or they're not worth wearing? I mean, again, my belief is that N95s are the best for protection. The masks are also great protection, especially to emit these viruses when you talk, when you speak, when you cough. You can decrease the emission. And if everyone's wearing a surgical mask, if all of us wear surgical masks or any kind of a covering, it will decrease the emission significantly. So if I save you and you're saving me, we're saving each other, I think that would decrease. But I would ask you the same question. Would you agree that surgical masks are less, but still definitely worth wearing? Yes, I agree with you. I think that the only people that should be wearing N95s are frontline healthcare providers in the hospital setting, or let's say in the office setting, but doctors that are taking care of patients. Those N95s are not supposed to be for routine use. Definitely, if you look at the public, if you're keeping your distance, and if everybody is wearing some sort of a mask, then the chances of transmitting to each other will be much lower. So if you're wearing some sort of a covering, surgical mask, or even a scarf or something that you make at home, and then you keep your 6 foot distance, the chances of you transmitting to somebody else and the chances of them transferring to you becomes extremely low. The other question that I've been hearing a lot is, can we order food and get deliveries from restaurants? Can a virus be transmitted via food delivery?
So I think the answer is yes. If somebody, let's say somebody is making you some sort of a sandwich, and they're going to deliver that, and they cough on the sandwich, and they have it, and they can, that we know that the virus can live on certain surfaces anywhere between 3 to 10 hours. So the answer is yes. As much as you can, it's better to prepare your own food. But if you want to order produce to be delivered to your house, that's okay. So, for example, if you have a farm or Instacart or something like that, they deliver to your house, my recommendation is you keep the food outside the house, outside the house or somewhere in the balcony or something like that. Let it air for a period of maybe 5, 6, 7 hours. Then after that, bring it in, clean it up, wash it like you would wash it the way you would wash your hands, so with soap and warm water, and then I think at that time you would be safe. Some people also ask the question of what if you want to bring your older parents, and I just made a comment about this on one of the groups, that please in the next 2 weeks tell your parents, tell people over the age of 65, please do not go outside for whatever reason at all. Don't go getting your medications. Don't go getting your prescriptions. Don't get, the pharmacies deliver. Most pharmacies deliver. You can ask your younger children to order things for you at home. Don't go to the shops. Don't go to Ralph's. This is not the time. Absolutely not the time. So, if you order on Instacart and they can bring it to you, that's better. And then you can follow the procedure. Let's say your family, the younger people, want to cook you something and bring you at the door. So let's say you want to make a stew or sabzi or something like that. They bring it with the pot to your house. You wear gloves. You take that pot inside your house. You dump it into your pot, and then you bring the pot back and you put it at the door, and then you take off your gloves and you wash your hands. That's the procedure you should follow.
So as far as the food from a restaurant, I tell them that if the food is something that you can actually put in the oven and warm it up to a proper temperature, that should hopefully get rid of the virus. But if it's something that you use cold, salads and stuff like that, I always also say try to stay away and make your own salad after you wash it properly with soap and disinfectants. The question is, how long do you think the virus has been in the United States? I know we started talking about it sometimes in February, but do you think that it could have possibly been here maybe in November?
So I know that now, looking back and knowing how COVID behaves, that I had patients that I took care of that had bizarre symptoms. I actually had young people that I was putting it on IV at home for some sort of a viral gastroenteritis, vomiting, diarrhea, abdominal pains, all kinds of workup were negative. Also people that had these prolonged 2-3 weeks of cough that, I couldn't figure out what was going on. Back in early January, I don't recall anything in November. I think that the first discussion of this was probably end of December in Wuhan. And we know now from the data that came out that 430,000 Chinese people have traveled to the United States. I'm sorry?
Yeah, I agree. They have traveled that many people in February and not in February, in November, December.
Right. So there was significant exposure, and there's definitely potential that a lot of people were exposed and we just didn't know the symptoms. So I think that, it's quite possible that we've had it since December and January here.
Trying to just go through all these questions coming up. The front filter N95 or NIOSH, are they okay? I think, as we discussed, I think we are trying, as Dr. Emrani said, and also I believe that if you're not a healthcare worker, and N95s are actually extremely rare in these hospitals, we we ask people not to necessarily wear N95s unless they're extremely high risk and somehow they get their hands on it. But they should really leave this for other people. A question that keeps coming up: do you believe that if you get infected and you have positive antibody, that you are protected? And what do you think is going to happen if people that are positive antibody go back to work? Is it possible for them to infect others if they have coworkers that are infected?
Okay, so I'll try and answer that to the best of my knowledge. I don't think that you can get reinfected within at least 1 year. I think that for all intents and purposes, from everything that I'm looking at, once you get the infection and you recover, that you are good for at least 1 year. So that the fact that after 28 days, or whatever that period is, 14 to 28 days, I don't think that you are going to get somebody else infected, because you're not having any symptoms and you've gotten over it. Now, if somebody else is sick and they come to you, you're not going to get it. So you can return to work. And I think that that's one of the procedures that we are going towards in terms of how to go back to life, because we can't be all in quarantine forever. So I think that what's going to happen is, the way that we're going to look at is, I posted an image of the two major antibodies that we're going to be looking at, and that's going to be a quick rapid test that's going to be out soon, within the next week or two. That is a finger stick. So just like when you check your sugar, you do a quick finger stick. You do a drop of blood in 2 holes, and the first hole is for the IgM, as in Mary, which is the initial bump of the antibody. That's the initial reaction to the virus. And then the second one is for IgG, which is a much later one that comes out. And so if you show that you have IgM, it means that you are acutely infected, which means you have the virus now. If you have IgG, it means that you were infected in the past. So anybody who has IgG can really return to the workforce and go back and start supporting the economy, because there are now 2 or 3 major concerns. The number one, of course, is our health and life, and making sure that we're all alive and healthy. Number 2 is going on with the economy, and number 3 is going to be mental health, because a lot of people are going to develop anxiety and depression and PTSD after this.
Right. So I think the test actually, from what I'm hearing, we're getting it in our office this Tuesday, possibly Wednesday. I think that is going to definitely be a game changer. As far as the medications, there are a bunch of new medications. I know everyone's talking about hydroxychloroquine, because that's something that President Trump spoke about, and Zithromax. There are new medications that have come up. There's another one that is actually completely the antiviral that has shown to work against COVID-19. What do you think? How promising is that, do you think?
So which one are you? All of the ones that are out? Are you asking?
Well, I think the one that they came up recently, that it's not the one that were against HIV. There were 2 that were against HIV. There was another one that just came out.
So let me go through all the type of treatments that there are. The first one, and the most popular one because of President Trump, is hydroxychloroquine and the Zithromax. And really, the data, there's 2 ways to study a drug. One is a proper scientific way of studying the drug, which is giving it to a number of people and giving a placebo and randomizing the trial and crossing over. And this hasn't been done with this combination of drugs. It's sort of like a wartime, and you just give it to everybody because you think that's what's going to work. And so there's really not good science behind it, even though there's a lot of anecdotal experience with the drug. So it's still not science. I got to just make sure I say that. And the dangers are not as high as people say. I know that there's a danger of QT prolongation and causing arrhythmias and causing sudden death, but the dangers are not that high, even though if it happens, it's a very highly risky thing. But we don't have good science behind that. The next one are antiretroviral medications, which are medications that we've used in Ebola and in previous SARS and in HIV. We have medications such as Calitra and so on and so forth. And these medications have shown some hope, but these are all medications that are being repurposed. Repurposed means that it's a medication that's, for example, being used for malaria, and now it's being used for this drug because we need to have some sort of a treatment. And as part of this whole conversation, what I would say is, and I think this is very important to know, that the chances of us having a vaccine is nowhere near. I don't think that we're going to have a vaccine for the next, year and a half, maybe 2 years. So vaccine is really not the way to go. We need some sort of a treatment so that people can go outside and say, okay, you know what, if I get sick, I can at least have some sort of a treatment so I can get better. There are other treatments, such as the convalescent serum. Convalescent serum is somebody who had the disease, got better, waited the 28 days, has a negative test, and now they have positive IgG. You can take their blood, and there are two uses of that. One is to give it to the frontline workers, to give them immunity for about 2 weeks. So a nurse or a doctor that goes to see the patients can get an injection of that, a small injection, and they are covered for about 2 weeks. So they would have to get it every 2 weeks. Or let's say somebody who's decompensating on a ventilator, they're not doing well, and you can give them that serum in higher doses and get them better, and there's some data that's doing better. There are other medications that are anti-parasitic medications. There are tapeworm medications. There's a new tapeworm medication that 2 doses of it. So 1 dose today, 1 dose tomorrow, 48 hours. In vitro, that means in a test tube, not in human beings, completely destroys the replication of the virus. So that needs to be tested in human beings, and it looks promising. That's great. And then there is a final drug that is now being evaluated, which is
Looks like they have a little bit of a technical.
Yeah, there's a final drug that's being evaluated, which is for this virus specifically. This virus, when it enters your lungs or your heart or your kidney or your GI tract, there is a receptor.
We lost you again.
I'm back again. Sorry, I apologize. So the drug, the virus attaches to a receptor called ACE receptor, and there is a drug that you can actually make the shape of that receptor, put it in the body, and confuse the virus so that the virus, instead of attacking the lungs, will attack the drug, not attack the lungs itself. So you basically saturate the virus out. So that's another treatment out there.
How does it affect that virus? And that's the remdesivir or something like that. How does it affect the ACE, for the ACE inhibitors or ACE blockers that we use on our patients?
So we don't know what happens with the patients who are on antihypertensives. My guess is that if a patient needs to get this drug, they would have to be off of the blood pressure and be switched to another blood pressure medication for the duration of the therapy with this specific receptor blocker. But we don't know yet. This is in now phase 2 trials, so that's something that we're going to learn for sure. But this is the only medication that's actually being evaluated for this specific virus. So we're learning about it, and as I learn more about it, I will definitely post on it.
Great. So the other thing they're asking is like when you're going to go for a walk, what do you do with your babies that it's very difficult to put the mask on? So that question someone asked me, and I'm trying to get my kids actually to post something on Facebook of how they make their own masks. And I know that it's very similar to what the Surgeon General did. I don't know if you watched that video. Took a scarf and folded it and put a elastic band around it and just put it on his face. I think, if you have your kids making something like that, I went out with my walk with my kids and they both made their own. My son obviously wanted to wear the bandana to look like a gangster, but my daughter made her own little napkin and folded it and made that. I think if you ask them to make their own mask, they really appreciate it. As far as a 1-year-old, I don't have an answer. I don't know if you can think of anything for a 1-year-old. If a 1-year-old needs to cover as well.
Yeah, that's going to be tougher. I think that a 1-year-old, maybe if you have them in a stroller with something covering them, that's probably the best you can do. And hopefully give them some Benadryl before you go for a walk or something. I'm just kidding, but maybe a little bit of Menishewitz before you take them.
Benadryl, just to clarify, Benadryl not for the allergies, just because Benadryl can put the kids to sleep. I just wanted to make sure that people got that. It's not to get rid of the allergies.
It was a joke. I'm not.
I know. So they say, what is this? What is it about this virus that has this wide range of symptoms? People from respiratory symptoms to GI symptoms. Now I hear there's something about people getting some brain issues and neurological findings. Why is it so different than just the flu? Because the flu just affects the sinuses and the lungs. This one apparently affects all your body.
So it's actually very simple, but we just didn't think about it until nature proved itself. It's the receptor that the virus attaches to. It's called an ACE receptor. So the ACE receptor is in several places in your body. The most prominent place is your lungs, but it's also in your heart. It's also in parts of your brain, which is why people get loss of smell or loss of taste. That's one of the most distinct things about this virus. People say that they completely cannot taste or smell anything for a period of maybe a month once they are infected with this virus. Not everybody gets the same symptoms. So some people get it attacking their lungs. Some people get it attacking their smell. Some people get it attacking their GI tract. So you get nausea, vomiting, diarrhea. And there is evidence of people getting heart attacks. So we've had young patients who've had a heart attack or what we call a viral cardiomyopathy, where the virus actually attacks the heart. And sometimes we've had patients where the virus attacked the lung first, and then as they're getting better, it attacks the heart. We also have ACE receptors in the kidneys. So there are people that present to the emergency room with kidney failure. And we have ACE in part of the spinal system. So there is actually a neurological deficits that we're finding. So basically anywhere in the body where there is an ACE receptor, this virus can attack. The most common place though is the sinus area and then the lungs.
Right, so one of the things people are saying, they say, and I don't know how I can answer that, supermarkets stop delivering. I don't know how it is like in California if the supermarkets still deliver, but I understand that now that the holidays are around the corner, everyone's ordering, and it's extremely difficult for these supermarkets to deliver. What I suggest is, make sure that you do wear your proper mask. One of the things, obviously, about the mask that we said initially, that we did not recommend people wearing a mask in the beginning because many people touch their faces and they keep adjusting their mask, and we believe that you can actually get infected that way. I think wearing a glove will decrease that because people don't like to touch their faces with the glove. They think the glove is dirty, even if they put the glove on just right now. But one thing I suggest to my patients and to the people that ask me, wear your mask in the house as frequently as you can, because then you start getting used to wearing a mask. So when you go out, you're not going to touch your face and touch your nose. And if you have to itch your nose or you have something that you need to adjust it, try to adjust the mask from outside. Don't put your hand behind the mask, because obviously that's how you can get infected. I can't really do anything about people delivering or not. This is their business. I can't get the people that are working for the government or now at home to put them at risk and say, you go do the shopping for people and deliver, because obviously that's not their job title. We can't ask people to do that. There's so many people that are home because they have to be home, because they're ordered by the governor to be home. So I can't ask them to go ahead and do these kind of shopping and do the shopping list for people, because again, we can't expect them to put their life at risk. So my suggestion is definitely get the younger people, the healthier people who can wear a mask and go out. They should be the ones doing the shopping. As far as when we're going back to normal, I think that's a question that I get almost on a daily basis, multiple times. I wish I had the answer to that. I think the way I'm looking at it, at least locally, I'm looking to see how many new cases we get. It is unfortunately difficult to assess because in the beginning we were not examining and testing everybody, and even now we're not testing everybody. And unless we really have a form or a method to test everybody, it's extremely difficult to know how many positives you have and how many negatives you have. So when we started checking recently, and I'm sure in California and other places similar, that people, all of a sudden, you get a huge spike of positives, but that doesn't mean that all of a sudden all these people are becoming positives. It could have been that we had a lot more 2 weeks ago that didn't get checked, and now they're feeling better and they're never going to get checked. And then we have smaller and smaller people that are becoming positive. So I can't really say where the curve is holding. I don't know if you can. I still see in Great Neck area in Nassau County, the numbers are increasing, but the numbers are increasing because we're doing a lot more testing. So I don't know if we are at the top of the curve, at the bottom of the curve, still going up, or on our way down. I don't know if you have an answer to that.
So unfortunately, New York has become the epicenter of the world for this virus. And I think that people in New York have to be extremely, extremely careful and on their toes. Other cities in the United States, thank God, are doing a little bit better. I think that we're gonna be able to tell where the plateau is in the next 2 weeks. And my guess, based on all the graphs that I've studied, is the first week of May is where we're going to plateau. So now, what does that mean in terms of life? Let's say if we plateau in the next, let's say 6 weeks, and then let's say we peak and plateau in the next 6 weeks, and then we come down starting 6 weeks after that. So, I can assume that people can start returning to some sort of life in about 3 months from now, maybe 2 to 3 months from now. Now, what does normal life mean? Normal life doesn't mean that we are back to where we were 3 months ago or last year. Normal life means, I think, that you're going to be tested, and if you have immunity, then you can go back to work and you can go do whatever you want to do. If you are young and healthy, you are going to go ahead and go out, and if you get sick, hopefully we'll have some sort of a treatment for you. And then people who are higher risk are going to be kept in quarantine for longer. until we have better treatments and until we have better methods of maybe immunization at some point. But I don't think that anytime soon, even within the next, let's say, 6 months, we're going to go completely back to where we were last year. I think that process of the entire country being back to where it was is going to be a long-term process. But I think that for most younger people who want to go back to work and take care of their life, we're looking at maybe about a 6-week, 2-week of climb, maybe another 4-week of plateauing, and maybe another 6 weeks of coming down. That's my best estimate.
Right. So that is, again, state by state and location by location, that will be different. And I'm sure when President Trump was talking about going back or starting going back to some kind of a normality, I think he's talking about different areas at different times. Obviously, there's some areas that have a much sharper sort of increase in the numbers. There's some areas that are the curve is a lot more flat. So those things have to do, and I think as in the next couple of weeks, we'll know in each area how we're going to be. For example, in New York City, right now, Brooklyn and Queens are the highest numbers. And as you go farther, the numbers go down. Upstate New York is going to be about a week or two behind New York City area. And I'm sure in any area you go, the more dense area is going to be the one that gets hit first. And then the other area is going to have a sort of a spike following that. The next question is, can you get the virus through the eyes, as you say? Based on what I've heard, yes. Would you have eyes and ear infection signs? For example, do you get red eyes? Do you get ear pain or some kind of a ringing in your ears or anything like that with this virus?
I think any inflammation in the eyes, in the sinuses, in the mouth and the ear, they can cause different symptoms in different people. I think that if you have a viral type syndrome, I think you should just consider that you have COVID and take care of yourself and your family. Based on that, not everybody needs to rush out and be tested. Not everybody needs to be treated. Most people, again, 99% of people, if you are low risk, you're going to get better and there's going to be no problems. Just stay home. But in terms of the symptoms, usually dry cough, fever, runny nose and sneezing is usually not part of it. In terms of ringing in the ear, I haven't heard of it, but I can assume that it could happen.
The question that I see a lot of, can dogs and cats or any kind of pets get this? And I saw that there was, in Bronx Zoo, apparently one of the wild cats got the virus. I don't know how they check the cat. They can put
and how they got it.
Right. Have you heard that? I mean, I've been telling people that dogs don't, but I after this, I really don't know.
Yeah, I mean, I think it's concerning. Generally speaking, we've been told that pets. I mean, not too many people have tigers at home, and maybe Tyson has a tiger at home in that movie. But anyway, most of us don't have tigers at home, so I don't know about tigers specifically, but I know cats and dogs who have lived with COVID positive patients have not turned positive and have not had any symptoms. Now, I don't even know if there has been any type of testing on pets so let's say, we have children or infants who have lived with COVID positive patients who don't exhibit any symptoms, but if you test them, they are positive. So they're carriers, but they don't express the symptom. Could it be that if you tested enough pets, that pets may not have any symptoms, but they could carry this? And as far as I know, the answer has been no. But every day we're learning new things about this virus that we didn't know. So, for example, this news of this tiger being positive is sort of concerning. But I wouldn't cause hysteria over it that everybody with a pet is gonna have it. I don't think so.
I hear this also. I just went over it about what the videos out there that put a hair dryer. We talked about it previously, in your nose and in your throat, and you just heat it up until you burn the virus. I've said it. Dr. Emrani said it. Please don't do anything like that. Don't burn your nostrils. Don't burn your throat. It does nothing but actually make you more susceptible to get infected, because you're destroying your first layer of defense, which is a normal mucosa. And if you burn it, you really can get infected, not only with this virus, but with other bacteria. So do not listen to those things. Take your vitamins. Dr. Emrani said it, vitamin C, vitamin D, and zinc. I don't know if there's anything else. Do you suggest 3,000 of vitamin C for everybody?
Yeah, 3,000 of vitamin C, zinc about 50, and D3 about 5,000.
5,000 a day. So I think you do that, and as we discussed it last time, sleep well, exercise, and don't be so stressed out. I know it's difficult. It's much easier said than done. And that hopefully should keep your immunity high. When will the sports be back? I don't know if I care at this time. I think I would leave that for later too. I'm hoping that that's going to be the only thing that we should think about. Not other important things. We don't know. They're asking if we have reached the peak. I can't really say that we have. I don't know. The IgG and IgM, how long does it stay in your body? I think you mentioned at least a year that we know of, unless there's going to be some mutation that we need to be hopefully vaccinated. Hopefully the vaccine is going to be here, but I'm hoping that this is going to be a lifelong immunity. Two questions I have, actually. I've heard that type O blood type does better. Have you heard that?
Yeah, I've heard it. I haven't seen any real science behind it, though, so I really cannot comment. But I definitely know that I've had a lot of patients asking me to send them for blood typing, and I just tell them, sit tight. There's nothing you can do anyway about it.
All right. And as far as this, if you were born in certain areas, you got the vaccine or the thing for TB, the BCG it was, I think that's called.
Correct.
BCG. So I hear that there's some immunity that you may have with COVID-19. You've heard that also?
Yeah, there's some information out there that people who've had BCG vaccination, so people from Iran, people from Russia, of older age, that they may have some sort of immunity to this virus based on the vaccination that they had, and they're actually studying the vaccination as part of a potential vaccine for COVID. But again, there's not enough data to speak more on it.
And do you know if you are, for example, right now, many of us actually have to do PPD testing yearly. If you used to be PPD positive because of the BCG and now you're PPD negative, are you still, based on these studies, are you still protected or have some protection against this virus? Or obviously we don't know enough yet.
Yeah, we don't know enough, but it's a great question. It's a great question to answer.
Seeing a lot of questions. I don't know if you saw any questions that you have been able to try to read as, there's hospital about delivering babies. So I tell you what's going on in Maimonides. I can say that Maimonides, North Shore, most hospitals, there's a significant number of patients, pregnant women that come in that they're COVID positive. The way it works, if someone's symptomatic, if we don't know, we put them in a isolation and check them, and they get their own room. Obviously, doctors go in with full gear. Every time you have to examine for deliveries and surgeries. I've done a bunch of those in the past couple of weeks. Babies usually do very well. So far, I've seen every baby does well. I have heard about babies that don't do so well. Most kids have been negative. I don't know how this can be passed. We don't believe that it can be passed through the placenta. As far as the nursing, a lot of people ask if you're COVID positive, should you nurse? From what I have heard, it's not something that you can pass with nursing. The problem is when you are nursing, you get very close to the baby, and that can actually pass. So some people say maybe you just need to pump and ask someone else to nurse to feed the baby. But again, one of the things that I tell people is really at these times, try not to get pregnant. I've asked my patients to really stay on birth control as long as they can for many different reasons, and I would just continue them until at least another 3 to 6 months when we are really coming out of this whole situation. And those are the things that I've heard. Vitamins again, 3,000 vitamin C, 5,000 vitamin D, and 50 of zinc. I don't see any more questions. I don't know if you have a message that you want to send.
Yeah, so the most important thing I can say is please be safe this Passover. Do not get together outside of your nuclear families. People who you've been with. A lot of people have asked me, well, I've been at home for 2 or 3 weeks and I don't have any symptoms and I've been fine and I've been in quarantine, so that means I'm not sick, so I can go and visit my parents. The answer is no. There's no way that if you're a carrier, if you, God forbid, give something to an older, vulnerable person, they could end up in the hospital, and that's something that none of us want. In the next 2 weeks, especially during Passover, we really need to be extra careful. Please just stay safe. This is like the plague that came over Egypt, and the Israelites, the Hebrews, were told to stay at home and let the spirit pass. That's what I would tell you guys. Please stay home, let the spirit pass. Hopefully next year we'll be together. Next year in Jerusalem we'll be together healthy and happy, but this is not the year to get together. That's the most important thing I can tell you.
Right. So 2 other questions, and I think we're going to finish with this. Do I think that the dentist should go back to work? I say absolutely not. I don't think dentists should go back to work, especially for routine stuff. Obviously, for emergencies, someone has anything that needs to be like any other emergencies, they should. And why not to get pregnant? Well, why not to get pregnant? Because when you are pregnant, and I don't know how long this is going to continue, you do have lower immune system. And at least we know that with the flu. So we don't want anyone to really decrease their immunity, especially during this time. So best is to try to stay away. At least that's my recommendation, and I've spoken to a few of my colleagues, and they believe the same. As far as the dentist, I'm going to ask you also, do you believe they should go back?
No, only emergencies. So if somebody has severe pain, of course, they have a root canal, they need to have help. But
right. So one of the things I wanted to also echo Dr. Emrani, every year in our village, we removed the nighttime regulation that you cannot park outside because people had guests, and we wanted them to bring the guests, and they were able to park in the streets for 2 or 3 days. This year, I'm not removing that restriction. The restriction and those regulations are going to stay in place, and we're going to make sure that they get enforced strictly. We do not expect anyone to have guests, and I want to let you know that the Nassau County Police is aware, and they will go in. again, this is not coming from me necessarily, it's coming from Nassau County and also New York State, that if they see that there are a lot of cars parked in an area, they will possibly go into that house and make sure that there are not a huge gathering. So I really urge you, I'm begging you not to do this year. I know it's difficult, especially for people that are older and maybe at home by themselves. Extremely important not to bring them in. Don't go to their homes. It's just going to be another day like a Shabbat day or regular day. We have our matzah by ourselves and have the Seder. But just 1 year, I think if we stay, we can save everybody's a lot of lives. And with that, I wanted to thank Dr. Emrani. It's always nice to see you. Looking forward to hopefully see you after this whole nonsense is done and we can talk about something that is actually possibly more fun to talk about. With that, I want to wish everybody a happy Passover and happy Easter. And I wish you well, a happy and healthy and a successful year. And hopefully we'll get back to our routine, whatever the routine is, in a few months, and one day maybe we forget about all of this.
God bless you for doing this. This is really tremendous public service you're doing. I'm so proud of everything that you're doing, and thank you so much for having me as part of this. It makes it's gives me. You're such a kind person to do this for me. Thank you.
I'm very appreciative of you accepting I know I just called you today. I really appreciate you accepting it in such a short notice. I know you're extremely busy. But again, send my regards and best to your family and stay safe. And happy Passover to you, Chag Sameach, and we'll talk hopefully after Passover. And thank you everybody for watching, and I hope that you send us your questions, and I'm sure Dr. Emrani is answering a ton of questions on a daily basis, and I'll try to do the same. Be well, Chag Sameach, Dr. Emrani.
All right, so there it is.
God bless you.
Be well.
There it is, everyone. I don't know what you thought. I have some thoughts of my own. And I don't know if folks have the stamina and energy and wherewithal to stick around and have a discussion, the post-game summary or analysis. But I'm happy to do that and host that if anyone's interested to do that. I think we will have to restart this stream, and that's what I will do. If anyone's interested, come back and we'll have a discussion, hopefully. I will hopefully see some folks back in exactly 30 seconds. And if there's interest, we'll have a discussion about what we heard from the mayor, what we didn't hear from the mayor. I have some thoughts of my own. Same thing for Dr. Emrani. Thanks, everyone, for joining Virtual Town Halls. And the stream will restart momentarily.